Welcome to Straight Talk with myObMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write in all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org. Welcome back to another episode of Straight Talk with myObMD. I'm your host, Dr. Dana Smith, and I am so excited to be talking to Dr. Amy Roskin. Dr. Amy Roskin is a fellow OBGYN physician who has transitioned into something that I actually had not known before. She specializes in the mental health and well-being of moms and moms-to-be, as well as patients who want to be moms but are not experiencing that. So welcome, Dr. Amy Roskin, to Straight Talk with myObMD.
Thank you so much, Dr. Smith. It's a pleasure to be here today.
Thanks for taking the time. And I'm really excited to talk to you. First of all, just tell us a little bit about how you have transitioned from a general OBGYN physician to becoming a mental health specialist for the ladies who we have cared for all these years.
Well, of course, as you mentioned, my clinical background is I am a board-certified OBGYN, but I'm also certified in perinatal mental health. I was in private practice for 20 years, taught at med schools as part of their faculty. But really, as an OBGYN, it was always striking to me how common these perinatal mental health issues were for my patients. And it was always frustrating how difficult it was to find care for them. And so that really kind of drove me to find out more, to learn more about what people experience and what we can do to prevent it and treat it.
Mm-hmm. And I can definitely attest to that. You know, the ladies who present to us, who we know have mental health challenges, we are prepared to treat their high blood pressure. We're prepared to treat their diabetes. We are prepared to treat everything else, but our preparation for treating their mental health is sadly falls short sometimes. So you're right. I can definitely commiserate with that. Just finding help for those who are in need can be challenging. Often we end up sending them to the general psychiatrist, the psychologist, or social worker, or some combination of all of the above. So,
and it's surprising because you just mentioned the other conditions that affect moms and patients in general, and we wouldn't sort of dream of having those fall through the cracks. But yet that has happened with one of the most common conditions. I mean, perinatal mental health challenges are the most common complication of pregnancy, and it's the top driver, unfortunately, of maternal death. And so this should be, an essential, critical part of our training and part of common treatment. But I feel like, thankfully, the tide is starting to turn here with just the way that this issue is getting more attention. Here we are talking about it today. Trying to doing our part. And so I'm really optimistic for what the future holds for treating this.
Absolutely. And I'm glad to hear you say that you trained residents before, and we'll have that discussion about whether or not hopefully the day will come when this will be a part of our medical school or training curriculum to include the mental health of the patient.
Yes, in my residency, I don't recall any specific training related to perinatal mental health. I don't know if you have a similar
Same.
Yeah.
We never did. Not one day.
Yep. Same here. And so here we are.
Did.
I mean,
Yeah.
and it's shocking when you think about it. Here are patients expecting, to get the care that they so richly deserve.
Mm-hmm.
And to be honest, and I'm sure we'll go into this in more detail, but these conditions are readily treatable and diagnosable, and people
Mm-hmm.
can be feeling better. And so
Mm-hmm.
it's really tragic that it's gotten to this point. But as I said, here we are doing our part to turn the tide.
Here we are. Here we are. So tell us about Seven Starling. What is that?
Of course, at Seven Starling, we are a maternal mental health platform where patients can seek and receive care. Um, Access to care is essential to our mission. So, as I mentioned, we offer diagnosis, treatment, and support for every stage of motherhood. We provide direct patient care with individual as well as group therapy, as well as psychiatric evaluation and management. We
Mm-hmm.
partner with health plans, hospital systems, and OBGYNs to provide education and screening for patients as well.
Mm-hmm. And are patients referred to Seven Starling? How do you procure your patient pool?
Any and all ways. We are so fortunate to work with our trusted OB/GYN practices and partners who refer patients directly for care on our platform. We're
Mm-hmm.
also honored to partner with health plans and hospital systems
Mm-hmm.
to take care of patients that they've identified as needing care. And we also, and we can circle back to this point later, as you mentioned, a lot of OB/GYNs are not really comfortable screening
Mm-hmm.
patients for these conditions. We are happy to take on that aspect of care for OB/GYN practices. We do the screening and we provide the care and care navigation for
Mm-hmm.
patients who should screen positive for mental health conditions.
And for our listeners who are OBGYN physicians, I know some we have a few some of our listeners are actually physicians. Are the practices that you support, do they need to be local to you or do can they be remote?
They can be remote. Absolutely. We are a digital health platform. We provide telehealth services already in 12 states, about to open in about 15 more shortly,
Mm-hmm.
and have our sites set nationwide. We already have contracts with the major health plans that are national in scope.
Mm-hmm.
And given the critical shortage of care
Mm-hmm.
and challenges that people face getting access to care, well, access is essential to our mission. And so that's a long answer, but no, they don't have to be local. They can
Got
refer
you.
patients to us
Okay.
from wherever.
Wonderful. Now tell us the website and your social media handle if you have one.
Our website is www.sevenstarling, that's spelled out, so not the
Mhm.
number, it's SEVENSTARLING.com.
Mm-hmm. Okay, very good. So let's get to the patients who you treat, the patients who are experiencing mental health challenges. First, let's start with the patient who is pregnant or maybe have recently given birth. You know, a lot of times people view this time of our lives as for those who have experienced that, a lot of times the predominant view is that this is such a joyous occasion. It's just filled with bliss, and there's just so much to be thankful for. And while it's true for most people, I would challenge that it's not true for everyone, and certainly not true for everyone at all times. So tell us about some of the other emotions that maybe go that others may be experiencing during this time.
Well, it's a time of profound change. I think we can all agree on that. And these
Mhm.
changes can be physical. Birth can be, for some lucky folks, a very easy process. And for many other people, can be quite an arduous ordeal, whether it's a long labor, an induction, complications, C-sections. Um, so for some people, there's a lot that they went through physically
Mhm.
that can be very challenging just on the strength of the body, right? And there are also so many emotions. Now, to your point, there are so many mixed emotions. There can be joy, but there is also a lot of stress. There
Mhm.
can be fear and anxiety. There can be sadness, thinking about, your past life that may be very different now that you have a
Mhm.
new baby. Um, People can be anxious about how prepared they are for parenthood.
Mhm.
Uh, Many people are concerned about support, whether they have sufficient social support, financial support. So I think it's a time of such change and upheaval that it's a time of a lot of stress. And the
Mhm.
stress can be psychological and emotional. And there's a lot of that stress that is physical as well.
Mm. So I know that some we're familiar with the different stages of depression that some ladies may experience. And one of the more common ones are the what a lot of people call the baby blues, the postpartum blues. Can you tell us a little bit about that? How you define it? What are some of the symptoms?
Well, I think baby blues, when we talk about baby blues versus something like postpartum depression, I think
Mm-hmm.
it's a question of severity and time length. I think
Mm-hmm.
it's very common for new parents to have some feelings of sadness, or I mentioned anxiety, worry, as well as fatigue. But usually you see them as fairly mild and they tend to improve within a few weeks, as opposed to postpartum depression, for example.
Mm-hmm.
That is a more persistent process. You can have more severe symptoms, whether it's lack of energy, sad or depressed mood, significant sleeping disturbances. So, as I mentioned, it's a question of persistence. So these symptoms don't resolve, and
Mm-hmm.
severity.
Mm-hmm. So the for the patient, I know like for patients who have just given birth, it's not uncommon to be anemic because you've lost blood. On top of, so um just so everyone knows, with anemia, you're going to be very fatigued, right? Because you're working with a fraction of your blood volume that you would normally have. So it's not uncommon to have fatigue because your body just does not have that. Your gas tank is just not full. And then now you're taking care of a newborn. So you have that added impact of fatigue. Um, and you have all these other changes in your routine, let's say. So some of that, of course, will impact how you feel. And now, how does the patient differentiate and say, this is normal, this is expected because of all the physiological changes that are going on, versus this is postpartum blues, or perhaps postpartum blues can be a factor of all those things we just mentioned. What are your thoughts?
Well, I think you raise a really good point, and we refer to this sometimes as multifactorial, right? So there are a lot of things going on, and you can be tired because of anemia from blood loss. You can be tired from all the upheaval in your life. Maybe your newborn is not sleeping well and you're up so often
Mm-hmm.
at night, you're breastfeeding. And so I think it's so important to have an ally and an advocate with your healthcare provider,
Mm-hmm.
because I think they should be able to help differentiate some of these conditions.
Mm-hmm.
For example, a blood count. What's the degree of the anemia? Has it resolved with iron supplementation and you're still feeling the same? Could it be another hormonal condition? Sometimes thyroid hormone disruptions can
Mm-hmm.
manifest with mood symptoms. Another important thing to check. And as I mentioned earlier, there are specific screening tests for depression, for anxiety, that
Mm-hmm.
can help call out things that are more fall into the realm of the mental health condition
Mm-hmm.
than purely physical. But the point is, since all of these things have different diagnoses, different causes, and different treatments, I think it's essential to try to know what is attributing to what symptom.
Mm-hmm.
If you're feeling a lot of fatigue, and let's say uh, are in the throes of postpartum depression, and you're not anemic, then, hey, iron is not going to do it for you. But on the
Absolutely.
other hand, if there's a component of your fatigue that is due to anemia, and some iron supplementation can help your recovery there, maybe that can
Mhm.
help you on the road to recovery and feeling a little bit stronger. but it's not going to do anything for your mood. So it is really
Mhm.
important to help differentiate what's the cause of this, which is so important, not in this area of medicine only, but in really all areas. If
Mhm.
you're having chest pain, well, did you pull a muscle? Are you having
Right.
a heart attack? I mean, these are the things we have to figure out. And
Right.
the good news is there are lots of ways to do that
Mhm.
for all these people who are feeling these things.
Absolutely, absolutely. And I think it's just so important that you mentioned the collaboration with your physician. And that actually reminds me, in past years, right? You've when you've had a baby, then you go from before you have the baby, right? You go to have senior doctor more frequent. You start off senior doctor once per month, then once every 2 weeks, then weekly. Then you have your baby, and then it was, oh, we'll see you in 6 weeks.
Yeah, you really hit on something there. And I always thought that was, to me, I was always sorry at that point because you get close to your patients, you go through this, with them, and you see the
Mhm.
whole process develop, and then it does start to change after the birth. But I think that's something that we could do a better job of
Mhm.
as in the healthcare system. And I think there have been a number of studies and a number of initiatives to maintain that contact with,
Mhm.
the new mom and the healthcare system. And that can just be a call from your OB's office. I know some hospitals take this on, to do some postpartum follow-up. There have been studies looking at home visits and how beneficial that can be. There have been some studies that recommend an earlier postpartum visit. So I would say, yes, all of that. I think it can be very abrupt for
Mhm.
patients and to think that, all of a sudden now see you in 6 weeks. But
Right.
wait, you just had a C-section and maybe it's the first major surgery you ever had. And all of a sudden, boom, you're just out. Well, I mean, in
Mhm.
general, I would see my,
Mhm.
for example, C-section patients before 6 weeks. But
Right.
um, I think the idea is to provide a little bit more support in the postpartum period. That's why some people refer to it now as the fourth trimester. And I think it's
Absolutely. Mhm.
well stated and it helps frame things in a way that makes us realize how important those weeks are after
Mhm.
delivery.
Yeah. And I want to pause and say that there is American College of OBGYN, ACOG, now recommends postpartum visit within 3 weeks. I know that not all practices observe that, but there is at least that push. And yes, like you said, that there are and patients who have had C-section, most practices will see you within 1 week. So yes, we are swinging that pendulum a little bit closer to where it should be so that after you've had your baby, you won't feel as if you're abandoned. Before we I neglected to do one thing. I neglected to just let our audience know that we are Dr. Roskin and I on this episode of Straight Talk with My OBMD. We are discussing depression. We are discussing depression symptoms, and grief. And so if this is we just want to let everyone know in case this may be a trigger of some sort. And also let you know that if you are feeling overwhelmed or overwhelmed emotionally or grieved, or more importantly, if you're having any thoughts of harming yourself or others, please reach out to the suicide prevention hotline by calling or texting 988. That's within the US. You call or you text 988. And there's also a website. It is, and I'm reading because I want to make sure I'm giving you the correct information. It's 988lifeline.org. 988lifeline.org. So, with that being said, so the postpartum blues, we know that that occurs in mild form and typically for 2 weeks, a 2 week period, and the depression will be more severe and lasting longer. What are some of the treatment options? Well, first of all, if you're the patient in your home, how you mentioned if you're concerned about this, you're going to seek uh, you're going to reach out to your physician, your care team, your physician or your midwife, and let them know how you're feeling so they can do a proper assessment to determine what your appropriate diagnosis is. And if you are diagnosed with, for instance, let's start with the postpartum blues, what are some of the treatment options for the patient at that time?
And that's where we're going to pause. For now, that is. I'm sure you're eager to hear the rest. So don't forget to subscribe so you get notified as soon as part 2 is out. We're going to dive even deeper, and trust me, you won't want to miss what's coming next. See you then.
Thank you for listening to another episode of Straight Talk with myObMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with myObMD.